Tonight on KQED Newsroom, Democratic presidential candidates faced off again this week, but this time the stakes were higher and attacks fiercer between moderates and progressives. Also, covering the homeless epidemic hour by hour to find stories and answers to the crisis on our streets. Plus, a new report reveals the hidden cost of childcare and who ends up paying the price. Hello and welcome to KQED Newsroom. I'm Marisa Lagos. We begin our show with the Democratic debates. 20 Democratic candidates took the debate stage in Detroit over 2 nights, sparring over health care, immigration, and race. On the first night, U.S. Senators Bernie Sanders and Elizabeth Warren faced off against the more moderate candidates over their plans to remake the American health care system. And on night 2, U.S. Senator Kamala Harris and former Vice President Joe Biden found themselves on the defensive. But with 6 months until the Iowa caucuses, it's unclear whether the debates changed the dynamic in the crowded field. Joining me now to discuss this are the president of Democracy in Color and founder of She the People, Aimee Allison, and joining us via phone from Los Angeles, LA Times staff reporter Tyrone Beason. Thanks to both of you.
You're welcome.
So, Tyrone, I want to start with you. You've been in Michigan. We've now seen 2 rounds of debates, 20 candidates. Where do you think things stand now after this more recent round?
I think more uncertainty. The Democrats spent a lot of time on stage both Tuesday and Wednesday nights trying to define the Democratic Party and obviously trying to chip away a little bit at Joe Biden's frontrunner status. But a lot of the discussion focused on some of those core issues, healthcare, immigration, how to restore the middle class. But I'm not so sure that it settled anything. I think Joe Biden comes out of this still in the lead, more or less, among the candidates, but there was quite a lot of vigorous discussion around healthcare and issues that people are talking about around the country without a lot of resolution. People seem to be pretty hardened in their positions on how to approach reforming the healthcare system or how to improve Obamacare and how to bring back the middle class, how to improve education, how to work on immigration, all those issues.
Aimee, let's talk about one particular candidate, Kamala Harris, obviously from California. You've known her a long time. How do you think she did? We saw her really come under attack, both from Joe Biden, but also Representative Tulsi Gabbard of Hawaii went after her for her record as a prosecutor.
That was something to see 2 women of color on the split screen. And one was one of the front runners defending her record as a senator, and the other one, this upstart congresswoman.
Yeah. Both
women of color. The significance of that historically is that women of color are 25% of the Democratic base. It's a very, very powerful voting bloc. I thought Kamala Harris had to defend her record. I think there's more opportunity in the next debate, and I think part of what voters, at least women of color that I work with every day, are looking for is an opportunity for her to explain in more detail her record and tell more of her story. I mean, we're looking for authenticity, vulnerability, kind of leading with the heart. But I have always said that any candidate, including Kamala Harris, is going to have to do 3 things to be successful in this primary. The first is take a bold stand for racial justice, which is why she shot up in the polls after the first debate. 2, she has to show clear moral leadership in the face of Trump and his misdeeds. And 3, actually organize a multiracial coalition in the state she needs to win. On every box, she's actually making positive progress, and so I think she comes out of this debate this week still as a front runner and still strong.
Tyrone, you spent time in Flint, Michigan before this debate, talking to a community that's really been beset by economic, environmental challenges. What did people there say about what they wanted to hear from these candidates?
Voters in Flint, Michigan, which is still dealing with the water crisis. For most of us, we think the water crisis was 5 years ago.
Right.
I was at a church 2 Mondays ago where hundreds of people were lined up from early in the morning until the afternoon when the truck finally arrived to get free bottled water. They don't trust the water. They don't trust public officials who are reassuring them that the water is increasingly safer to drink with filtration. There's a real distrust, I think, of the institutions of government in Flint. And people told me again and again, when I asked them whether or not they want to drink their water, they answered with, "I don't trust the government." And I think that the presidential candidates are going to have to be able to tap into the distrust that people have of government in places like Flint that have had so many problems over a couple of generations leading up to the water crisis and other issues. And how you rebuild that trust and that relationship is going to be key. I have to say that in Flint, when I asked people who they were supporting, no one was willing to tell me that they had a favorite. Kamala Harris didn't come up. Cory Booker really didn't come up. People know Joe Biden. They know Bernie Sanders. So those were natural, names for people to mention. But these candidates still have a lot of work to do to establish that they are different from the politicians and other public officials that they've become accustomed to.
Well, and Aimee, I think Tyrone brings up a good point, which is that, I think Trump did tap into that distrust. Whether or not you think that, he has fulfilled the promises he made is one thing, but I'm curious if you think you heard the candidates speak to any of the issues we're hearing Tyrone talk about.
Well, it's interesting that Marianne Williamson was the candidate who brought up the water in Flint, and that she'd lived in a wealthy suburb, and she said it would have never happened there. She made
clear.
Had a
great answer on reparations.
I'm saying on reparations, she was the candidate clearest about racial justice. She, as a white woman, taking a stand and articulating why it was important, but laying bare the fact that race has to be a part of every conversation, the environment, education, healthcare, all these issues have to have a lens of race. And look, this debate this week took place in an environment where Trump is directly attacking Black Congressman Cummings, and in fact, just today tweeted kind of a ha ha ha, he got his house robbed type thing. It's and in the wake of him telling elected congresswomen of color to go back to somewhere,
where they didn't
these
come
racist
from.
attacks. A recent poll said, the majority of Americans think he's a racist. So for Democrats on that stage, first night and the second, to not talk about their own personal commitments around race, to acknowledge it, is not only just bad politics, but it's not a winning it's not a winning approach. Black voters, I will say, I've been saying it for months, are 1 out of 4 Democrats, Black women being the majority of those. If the candidates are not ready to talk about race in this environment, they're not ready to lead the United States.
Yeah, I would agree. I heard the same things. I mean, the idea of being able to talk honestly about race, whether you're African American or a white woman like Marianne Williamson, who I spoke to at length when I visited South Carolina, where all the candidates had gone before the first debate. If you're not able to do what she did on stage the other night, then that really hurts your credibility, I think, with these voters. It's not that race is the only issue they're concerned about, but if you cannot talk about issues through the lens of race and historical racism and discrimination, I think you're at a disadvantage. And
I think that's why still Julian Castro, Secretary Julian Castro, is still a very big competitor, because you saw him on stage in the second night talking about his policing and criminal justice plan and really addressing the issue of race and in structural racism in a way that is very powerful and keeps him very relevant even in this big field.
Right. Yeah, I think 2 other issues I do want to get into: healthcare and criminal justice. Tyrone, we really saw on Tuesday night especially Senators Elizabeth Warren and Bernie Sanders kind of fending off criticisms of their healthcare plans and attacks that they're too radical. I mean, what sense are you getting among voters about this issue? Because this was really a winning issue in 2018, but there is this narrative that Democrats are sort of going too far on it.
I think they got maybe a little too deep in the weeds during the debate. But during the first debate, I was in Goose Creek, South Carolina, at an African-American barbershop with men, Black women and men. And the night before, that was the second night of the debate, I was in a very upper middle class, white gated community, suburban community outside of Charleston for the first night. In both settings, when healthcare came up, small group discussions started in the rooms. People are really concerned about whether they'll be able to access good health care. And they told personal stories of being gouged at an emergency room or having to go to another county. There's some places in the country where there's not a hospital in the county, or there's not one immediately accessible for, say, expecting mothers. So this issue hits heart and soul for a lot of people. How you talk about it is different. And I think that the extent to which candidates can speak to the everyday experience of dealing with the healthcare system will help determine their credibility in that area.
Yeah, and I think that that is one thing. You got to cut through the noise, right? This policy is complicated. Aimee, I do want to hit quickly. We only have a couple minutes left. Criminal justice. We saw a lot of back and forth on this issue about Kamala Harris, Joe Biden's record. Again, Booker, Gabbard, all mixing it up on this. Do you think we're in a new moment, just in terms of how we're talking about that and about race more broadly?
I think so. I think there's more and more recognition amongst Democratic Party base voters that the way the Democrats had supported a criminal justice system has done real harm to communities of color. It has criminalized marijuana use in an environment where blue states like ours are actually making it legal, and there is a responsibility on the part of not only those who are running for president, but an expectation of the base that's half people of color to redress those harms and to make things right through policy and practice. And I think a racial justice lens on criminal justice is forcing Joe Biden, who was a long-time advocate for criminalizing lots of behavior that's been terrible for the black community, black and brown communities, to really turn on a dime and to try to adopt different policies.
You know, we are seeing a huge debate about the future of the Democratic Party, how far left Democrats should go, if they're leaving behind more moderate voters. But isn't that what primaries are for? I mean, do you think that they're in a bad place here, or is it still early yet?
I think it's early, and better to have this conversation now than in 2020. I think that the party has to decide what it is. That's what I'm hearing when I talk to voters. They want, I think someone mentioned, the moral clarity. They want a sense of that they know what the Democratic Party is. What are its contours? What are its core values? Things they won't compromise on.
All right. Tyrone Beason from the LA Times, Aimee Allison, Democracy in Color. Thank you both for being here.
Thanks for having me.
Thank you.
For the fourth consecutive year, the San Francisco Chronicle is leading a group of media organizations, including KQED, to cover the issue of homelessness. From videos to print and audio stories, the SF Homeless Project shares the personal stories and struggles of the men, women, and families who lack stable housing in San Francisco. It also strives to answer questions about the crisis, which is getting worse even as the city spends $300 million a year to help thousands of homeless people through navigation centers, outreach visits, and other services. Joining me now to discuss the SF Homeless Project is San Francisco Chronicle reporter Kevin Fagan, who's been covering homelessness for 20 years. Thanks for being here, Kevin.
Glad to be here.
So, as I mentioned, you've been doing this for a very long time. You have spent time on the streets with homeless people overnight, including for this project. What's the one thing you want people to understand about this population and about the problem?
Well, there are different kinds of homeless people. There's the kind you see on the street, you know, the guy shooting up in his neck, laying under a blanket, and then there are people who go up from there, people in shelters who have jobs, people who are just in between, who are couch surfing. And the one thing that I always keep in mind is that there's always a human being in there who doesn't want to be homeless. I don't think anyone wants to be homeless. You dig through the layers of trauma and years on the street, and you find that spark in there in the middle of that person, and they want to get off the street.
And I should say, I mean, the stories that you guys are telling are very powerful and personal. But I do want to give this some context. There's 35,500 homeless people in the Bay Area, according to a count this year. 8,000 of them in San Francisco. 1,000 people on a wait list any given night for shelters. 42% struggling with addiction. Almost as many with mental health issues. And this to me is the really interesting one. 2,000 people housed in San Francisco in 2018, and they say for every one person housed, 3 more people became homeless. Yeah. What does that tell you? Like, what are the underlying problems here that we're not getting at?
It's a tide that keeps coming in, and what most experts will tell you who look at this from a macro level is that the federal government gave up its responsibility decades ago, and it's never been made up. So you have local communities trying to dig out of a problem that's really bigger than what they can handle. You have 30% of the country lives right about at or below poverty level. Right. That's a constant pump, putting people in. You got the housing prices here that are through the roof. The minimum wage hasn't kept up with it. It's guaranteed underclass. And until you fix that on a bigger level, you're not going to get rid of homelessness.
Yeah. I mean, one story that you profiled is a man named Shorty. He's wheelchair bound. He had been living on the streets for many years. Yeah. Talk to me a little bit about Shorty.
Shorty was a wonderful human being to spend time with. And my partner on this project, Jessica Christian, a great photographer, she and I spent a lot of time with Shorty leading up to the 24-hour period that we spent with him. And then during that day and night, He's got remarkable fortitude for a guy who's been on the street this long in his wheelchair. Right. He needs someone to push him around, to get him food, to dress him, to bathe him, and he had an amazingly upbeat attitude. He was an example to me of someone who, that human spark is always there. And Shorty did not want to be on the street. And actually, after our 24-hour period with him, he got housed, which made me very, very happy.
And he is still housed.
He's still housed.
But does Shorty speak to you like emblematic of a bigger story here in terms of, I mean, he does have a drug addiction
yes.
That he's struggled with. He is disabled. I mean, what did your experience with him sort of tell you about this broader problem?
Well, I've lived overseas in England, Australia, New Zealand. They treat their people better. I think we shouldn't have this in America. We should have a health system and a housing system that does not let a guy live in a wheelchair who's disabled and drug addicted in the street. I mean, he hadn't bathed for 2 weeks when we spent the 24 hours with him. That's unconscionable. How can we live in a country that lets that happen? It's astounding. And this is a compassionate city that spends a lot of resource to help people in desperate straits like that.
Well, and that's something we hear from critics is that we spend too many resources, that this is a magnet for homelessness. What has your reporting and the research we have said about that?
It's blaming the victim. Sure, people come to San Francisco, just like you and I come to San Francisco. Housed people, homeless people, I don't think it is a huge magnet. Right. A lot of research shows that most homeless people become homeless and stay in the communities they're at because it's familiar. They know their stomping grounds, they know where to go for emergencies. There's a survival instinct. It's not like the world is rushing on in here. Other places have homeless problems, and the homeless counts have actually gone up bigger in other cities.
Yeah, we've seen this across certainly California. Yeah. And we know it's cheaper to house someone than to leave them on the streets. And we have housed thousands of people in San Francisco. What does that tell you about sort of the intractability of this? That statistic that for every one person housed, 3 more people end up being homeless.
It's really tough. We have 9,500 people who live in supportive housing. Many of them come out during the day and panhandle. People think they're homeless. There are actually fewer people in a nightly count today than there were in 2003 when I spent 6 months sleeping in the streets.
But it feels worse.
It feels worse because it's cumulative. What you have is you have poverty in the streets as much as you have homelessness in the streets. Poor people who aren't given an avenue to make their lives better. Right. They can't get through their addictions, their mental problems, finding a job. They're stuck. And that's terrible. We shouldn't have that many people stuck.
I mean, you believe that this is fixable. We have seen in San Francisco a lot of efforts and resources and community support. We've also seen people fight tooth and nail to keep anything out of their neighborhoods. They cite crime and safety issues. We've seen this with the Navigation Center down near the ballpark recently. I mean, what would you say to those folks, and especially about sort of victimhood and crime? Because I feel like you're probably more likely to be a victim as a homeless person than you are as somebody with a safe place to sleep. Yeah,
I know from being asleep on a sidewalk with a blanket, someone's going to come kick your teeth in if they can. It is not safe being outside. I can also understand the concerns of people who are housed, because if you have a drug addiction and you're living outside, you got to get some money somehow, and that's generally going to be some smash and grab or a little bit of this and that. And yes, there will be some level of crime, but these are people in desperate need, and it's a societal problem. It's a problem that all of us have to handle. Everyone has to put in something if you want it to get better. And frankly, having a shelter where people can go inside, it's healthier for them.
And maybe safer for the community. I mean, because these, as we've noted, these are folks on our streets right now. I just want to end asking you, I mean, as someone who's covered this, who's spent time on the streets for 2 decades, do you have hope that this is something we can solve? I always have hope that we can solve this. Some cities have done this. Salt Lake City did it with a surge. It's backslid since then, but it can be solved. It has to be solved on a bigger level, but you never give up hope on something. These are people. These are human beings. They don't want to be homeless. And you think that the steps the city is taking right now are in the right direction? They're using the best practices. If they weren't doing what they were doing now, we'd have 30,000 people in the streets. You just have to grit your teeth and move forward. All right. Kevin Fagan from the San Francisco Chronicle, thanks for coming in and all you do. Thanks, Marisa. To see more coverage of this crisis online, go to sfchronicle.com/homelessness or kqed.org/homeless. A new report by the Economic Policy Institute and UC Berkeley shows that early childhood educators are 6 times as likely as K-12 teachers to live in poverty. They earn less than 70% of all California workers with a median salary of $13 per hour. The low wages and poor working conditions also affect the quality of care children receive. But parents are also under financial pressure, with the typical family in the state paying a quarter of their annual income on daycare. Joining me now is one of the study's co-authors and the co-director of UC Berkeley's Center for the Study of Child Care Employment, Leah Austin. Leah, thanks for joining us.
Thanks for having me.
So let's lay out the numbers here. On average, California families spend between $11,000 and $16,500 a year for full-time care. In cities like San Francisco, I know from personal experience that can be far more than that. Yet, as we just said, child care workers are far more likely than teachers for K-12 to live in poverty. Why is that? Like, given how expensive it feels for parents, where is the money going?
Well, the money is going to all the expenses in early care and education programs. It's true that personnel is the biggest expense in those programs, but by the time you pay for your facilities and all of the materials and things that you need, what's remaining, again, is between 60 and 80% of your budget is going to be for personnel, but you have multiple teachers in a classroom. You expect early care and education to be more expensive than K-12 education.
Right. You need more people.
You need more people. You typically have at least 2 teachers in a classroom. You have fewer children per teacher than you see with older kids, and so by the time you have you distribute those costs, you're left with, on average, $13 an hour.
So it's not as if the owners of these private facilities are making huge profits.
No.
So what's the impact that you guys found on both kids and the providers themselves? Maybe start with the children.
Sure. It's really important to, I think, understand that early educators are the linchpin of high-quality early care and education and the services that children receive. So in order to ensure that children are engaged and stimulated and that their learning and development is being supported on a daily basis, that relationship and the interaction with their teachers is really, really critical. And so when teachers are stressed because they experience economic hardship, they're worrying on a daily basis about how they're going to feed their own families. It really interferes with their ability to be as present and effective with children as they want to be.
What do you guys recommend? Well, I guess first to start, who are these teachers? Like, who are we talking about here? Is it mostly women, and is it people who may already sort of face institutional challenges to making ends meet?
Yes, absolutely. In California, as in most of the country, the majority of people who are early care and education teachers and providers are women. About 98% are women. And in California, they're mostly women of color. So we have a workforce that we already know across occupations that women and people of color experience challenges with wages, typically earning less than other workers than white males. And so you have a field where people think of it as women's work, and they don't really understand the complex job of teaching young children. And so you have all of this going into people's understanding or view of what it takes to work with children and apply a really low value to that.
And as you mentioned, that can play out within the child care centers because if these teachers don't have the support they need. I also wonder if we are subsidizing that in another way, which is through public benefits. Do you find that teachers in these situations end up needing to rely on the social safety net more? They
do. About 58% of child care workers in California utilize at least one federal income support. And so that's a really conservative estimate because we only looked across 4 programs. And so that's a marker of how low their wages are. And so those teachers are really subsidizing the system for everyone else because their wages are so low. If they were paid, as we suggest in our estimate, on an even field with elementary school teachers, for example, then that cost would go up.
Yeah. So what are we talking about in terms of how much we should be paying these teachers and also how much that would cost the state? Because as you guys report, families really can't afford to pay more.
That's right. So it would, our estimate looks at the total cost of the system. And so we estimate if teachers are paid, again, similar to their elementary school counterparts and have appropriate benefits, that would cost between $29 and $75 billion in California. And that variation depends on how many kids would actually participate in the system. So we make some different assumptions about that. But when you look at that at a per child cost, that's $30,000 to $37,000 per child, which really is what the cost in high quality programs really is.
Yeah. Where would you guys suggest that money come from? And I wonder if you guys looked at also how that could impact state spending down the road, because I would assume the better early childhood education kids have, the less likely they are to have trouble later on. So is there a balance here?
There is, and in our estimate we focused on articulating the cost as a starting point to say, here's what we need to grapple with and understand. But it is also important to identify and understand the value of that investment. There's been plenty of research over the last several decades that shows, for every dollar you invest in high quality early care and education services, there's a certain return, and that varies depending on study, but that's between $5 and $15 for every dollar invested, because it has these long-term benefits and outcomes for children. And you're spending less on other services down the road. So it has that benefit certainly for children, for our state. Right. It really supports establishing a good foundation for children's lifelong learning.
So we know that we have a governor now with 4 young kids of his own. He's talked a lot about these types of issues and has actually put some one-time money in the budget to help start building out the child care sort of infrastructure when we talk about facilities, one-time costs. But I mean, do you have any hope that the state is going to go further and take some of these recommendations?
I do. I think grappling with the sticker shock is a really important thing for the state to do, for state leaders to do, to really say, if this is what we want for California, this is what we know it's going to cost, and begin to build upon the investments that they've made thus far, and ensure that one-time dollars become long-term investments, and that we're looking at expanding services for families at the same time that those services are really high quality and working for children and the teachers who are caring for them as well.
Awesome. Thank you so much, Leah.
Thank you.
That'll do it for us. As always, you can find more of our coverage at kqed.org/newsroom. I'm Marisa Lagos. Thanks for joining us.